This is my skills blog. To start out with, the organization that I work for has a horizontal structure. We have a CEO and president, we have a chief nurse executive officer, and then we have each unit, and each unit has their own manager. So the ED would have their own manager, ICU has their own manager, behavioral health has their own manager, and then under the managers are supervisors, and then under the supervisors are charge nurses, and then under the charge nurses are staff nurses along with nursing aides and nursing secretaries. Um, Auxiliaries such as radiology and lab and material processing distribution, environmental services, they're all auxiliaries and they have their own managers, but they fall primarily under the CEO. And yes, our CEO has a big job, but it's a fairly small institution, so that's kind of how it's structured. Um, in my institution, where I would fall next if I was to be promoted would be in a supervisor role. And if I was to be put in a supervisor role, to do that job effectively and to retain my staff and to keep my staff happy, the skills I would use is I scored highest on the interpersonal skills on the leadership skill questionnaire. Interpersonal skills I feel like would help with being able to read your staff, understand their needs, also being able to understand your organization, understand your management. That's also important as an interpersonal skill. You also want to be able to motivate your staff. You want to be able to deal with conflicts and confrontations as well. So those interpersonal skills would be important in that aspect. Other skills that I got from the reading that I feel would be important as a nursing supervisor to have is ensuring that you have a good staffing model. When you have a good, accurate staffing model for your unit, you have an accurate nurse to patient ratio, which not only ensures safe patient care and good patient care, but it also ensures that you're not working your nurses too much or not enough. So um, another skill that I talked about in the text that I thought would be important to have as a nursing supervisor is coordinating. You want to be able to coordinate well with other departments. You want to be able to coordinate well with physicians. You want to be able to understand their needs and expectations when it comes to orders or paperwork or consents. And if you understand that with their departments and coordinating with their departments, you can then educate your staff on that. And your staff will be very grateful for that when they know what to do to carry out a chest X-ray or know what to do to carry out a surgical consent or that type of thing. It makes the nurse's job easier as well. So I feel like coordinating is a super important skill to have as a supervisor as well. The literature that I found that I thought really related to interdisciplinary care was an article I actually found out of a pharmaceutical journal, but it talked about interdisciplinary care focusing on the pharmacist and including the pharmacist in rounds and plan of care for the patient. I feel like that's so important because pharmacists have such a vast knowledge of medications, and when there's a medication regimen for a patient, having that outside pharmacist to be able to consult with the doctor and consult with the nurse on really ensures that the patient is going to have a really accurate and good medication regimen to be discharged home on or to complete their plan of care while in inpatient facilities. So that was the literature that I found. As far as identifying with levels and departments that I would need to work with in order to be an effective supervisor, like I said earlier, coordinating with lab, coordinating with radiology, coordinating with physicians, coordinating with material and processing and distribution. You want to have good working equipment. Environmental services, you want to have clean, nice rooms for your patients to come to. So being able to work with them is just as important as being able to work with your staff. And I think that will help you be able to run a successful unit and a safe unit for patients. As far as what model or organizational structure I prefer, it's the one I'm under. I really like the fact that I report to one person and that I go to that one person with my concerns or my needs for my unit, and that she can give me communication back and whys and ifs and that type of thing as to what she can do from an organizational standpoint for my unit. So I feel like that type of structure also too allows managers and supervisors to have more influence and more authority over their staff. You can also be more in tune as to what your staff needs, and it also gives you more authority over the patient care and the patient's needs to ensure that you're providing safe patient care and that you're going to be giving care that's going to give good patient satisfaction rates as well. So that's why I would prefer that structure. So that concludes my blog. Thank you.